share your expertise. And the
Thanks.
floor is yours.
Thank you, Hongmei. Thank you for that nice introduction. It's a pleasure to be here. Um, so my goal today is to give some advice and hopefully useful input on writing a specific Ames page. There's a lot of different ways to do this, but I'll share with you some of my tips and strategies that have been successful over the years. Um, it's not the only way to do it, but it is a way that has been beneficial for me. So, okay, so here's a general overview of the presentation. We're going to try to save questions for the end. Talk about the aims, like the aims themselves, rather than the aims page, but then move on to the aims page itself. How to write this very important piece of the grant application, hypotheses, and then some things you should do and things you should not do as you're putting together your aims page, and then a summary. So the aims page is arguably the most important page of an entire grant. It's one page. It's as a reviewer, you don't actually read the abstract initially. You might look at it, but you don't read the summary. You don't dive straight in. The very first thing you do as a reviewer, once you kind of look at the title and who the investigators are, is you read the specific aims. So it's the first thing, the first real thing that a reviewer of your grant is going to read. And it sets the tone. It gives the overview of the entire application. And it's really the first impression that the reviewers are going to get of your application. So it needs to be great. The goal of your aims page is not just to tell the reviewers what you're going to do. It's to get them enthusiastic and to sell them on the concept. Convince them that you have the right team, the right preliminary data, the right methods, the right innovation, that everything is there, and that this is going to be a great project. So it really does need to be as perfect as possible. The ideal aims page has a very formulaic structure to it. And you can vary this based on emphasis and how much space you give to any one of these pieces. But the aims page has to have some elements that are, if you don't have them, they're going to notice and they're going to criticize your application. So the very first point you have to make, and sometimes it's a full paragraph and sometimes it's just a couple lines, is the broad scope of the problem. What is it that you're trying to address? Diabetes is poorly controlled in a lot of people. HIV is a big problem, and we need more strategies to diagnose it. Usually the big problem is not something that there's a lot of controversy around. It's just you got to make the point that it's a big problem. The next point is the gap that you're going to focus on. HIV is a big problem, right? So great. But what's the gap you're going to hone in on? You can't study all of HIV. Where's the scientific gap, the gap in the field? That's a really a narrower statement or a narrower description than the entire scope of the problem. And then the next point is actually a critical point. And this is where you really need to be very succinct and very compelling. How are you uniquely positioned to fill that gap? We have preliminary data. We have a great team, a multidisciplinary team. This is our idea. And that will then, those comments will lead you naturally to the aims. Because you're saying, here's the problem, here's the gap, here's how we can fill the gap, and that naturally feeds into, okay, so these are the specific ways we're going to fill that gap: aim 1, aim 2, aim 3. And then so you're narrowing, you get to this broad, very important specific aim statements, and then you pull back a little bit out of that and you say, when we do this, X, Y, and Z, we're going to fill this gap and we're going to advance the field. So a little summary at the end. This is a very, very commonly used structure for a specific aims page, and I'll give you some examples later on. But it's a nice formula. It's what the reviewers are expecting you to do. This is not the time to be, a super creative writer. You want to be compelling and use this structure in general. So then that's a nice overview, but then what do you actually put as your aims? Because the aims are driving the grant. The aims page sets up the aims and the grant. So the aims are specific. This is what I'm going to do in this 5 years or 3 years. You need to tailor the aims themselves for the scope of the opportunity. So if you're applying for a 2-year grant, obviously you can't propose to do 5 years of science, and vice versa. So make sure that what you're proposing is within the scope of the time frame and within the scope of the opportunity. Typically, it's 3 aims for a 5-year grant. It just seems, I've reviewed hundreds of grants for NIH. I've reviewed a lot of grants that I'm part of or that colleagues are writing. 3 aims is by far the most common for a 5-year grant. There's something psychologically compelling about 3. 2 is not enough. 4 may be too much. 3 is a very common scenario of the number of aims. You can certainly propose 4. I'm not saying it has to be 3, but that's the typical number. But whatever it is, it has to fit within the scope of the opportunity, and fit within the purview of an NIH institute. What they are is should take you weeks to figure out what your specific aims are going to be. It's a critical question, it's a critical component, and it's going to drive the rest of the application. So you really need to decide your aims pretty early on. And I'm not saying you need to finalize the aims page. I'm saying you need to finalize those statements. I'm going to do X, I'm going to do Y, and I'm going to do Z. And those statements that are only going to take up, 10 lines in the grant, in this aims page, need to be very, very well honed, because they're going to drive how you write the rest of the application. It's really important that they fill a gap, right? That you have to identify a gap and say that the aims are going to at least partially fill that gap, and ideally more than one. It's also critical that they not be cascading or interdependent aims. So if you can't do aim 2 unless aim 1 is successful, that's bad. Because if you don't succeed in aim 1, the rest of the project falls apart. The reviewers are going to notice that, and you're not going to get a good score. So you want aims that are independent enough that if your hypothesis for aim 1 is not supported, it doesn't obviate the need for aim 2 and the work for aim 3 to continue. So you've got to structure your aims very carefully to make sure they're not cascading or not interdependent, that one aim is not dependent on the success of prior aims. There are some exceptions to that. If you have it's a developmental grant, and what you're proposing in aim 1 is to finalize the development of an intervention or finalize the development of a methodology, and you have enough preliminary data to say, you can do this and it's going to happen, it's not controversial, then it's okay to say, once we finish aim 1, we'll move on to aim 2 with what we've finalized in aim 1. That's probably okay. But just if it's a hypothesis driven aim 1 and your hypothesis is not proven to be correct, make sure your other aims are still important and doable. You need at least one hypothesis. Purely descriptive work generally is not going to be funded. And take a lot of time to get the aim statements and the scope right. Because it does, like I said, it does frame everything. How do you write this page? It's a tough page to write. My advice would be to figure out the aims, the actual work you want to do first, and then go from there and start thinking about the experiments you're going to do, the analyses you're going to conduct, the background and significance that you need to write, what you're going to do that's innovative. You don't want to get too far ahead of yourself on the aims page. And this sculpture, the picture of this sculpture here is to remind me to tell you a story. And so this is a sculpture. It's called The Rape of the Sabines, or The Abduction of the Sabine Women. It's by a guy named Giambologna. It's in Florence. It's standing in Florence in the Loggia dei Lanzi. It's still there if you want to go see it. This is about 12 feet tall. It's a huge sculpture. It was done, as you can see in the caption, in 1583. At this point, Michelangelo was a very old, famous artist, and Giambologna, the artist who did this, was a very young, up-and-coming artist. And he got an audience with Michelangelo, Giambologna did. And so he's this young 20-something-year-old guy. He goes in and sits with the master, and he brings in some clay figures that he's been working on, some models that he's been working on for sculptures. And the story is that Michelangelo looked at them and took this clay models and just smashed them and destroyed them, and gave the young sculptor Giambologna the feedback that you finished it before you got the fundamental structure, the composition perfect. He had all the details worked out, all the hair and all the nails and all the fingers and all that perfect, but the structure, the composition, the arrangement of the figures was not done yet. And Michelangelo said, you have to know what you're going to do. You have to get the core composition perfected before you put the finishing details on. So I think about that almost every time I'm working on a grant. I think about that story. Whether it's true or not, I have no idea. It's written down in a book that was The Lives of the Artists by Vasari. But the point is, your aims page is going to be your guide. But at the beginning, you just got to rough it out. You need to make sure that the aims are right, but don't worry too much about all the details. You got to get the core questions perfect and sound, and then you start building on the details. And as you work on the details, you're going to realize some of those questions need to be refined. So it's an iterative process going back and forth between the aims page and the rest of the grant. But one strategy to write it all is to look at the topic sentences from every paragraph of the draft of the full grant that you're writing, and incorporate those into the body of the aims page. So, in the background and significance section, you're going to have a paragraph that says why this is a big problem, a paragraph that says here's the review, here's the previous literature, a paragraph, a section on your innovation and your preliminary data. Take those highlights from those sections and pull them into the aims page, and that's a good way to flesh out the aims page. So the first paragraph or point, the broad scope of the problem, you can pull the main sentences from each section of the significance to write that. And the same for the gaps in the field. Pull that from the significance. How you're going to fill, how you're uniquely filled, positioned to fill the gap, that's preliminary data and your innovation sections, right? So look at those and summarize those in the aims page. And then the aims are just these brief statements, and that should be already written by then. And then summarize the methods and the expected results. And then there you have it. There's your draft of your aims page. But you can't do that until you've at least gotten a good sense of the aims you actually want to accomplish, and then started to draft the document. So you can see that it's a cyclical process. You're back and forth. Just like if you're making if you're painting or you're making a sculpture, you got to get the fundamental part down, but then as you work through the details, you might realize, you know what, this arm needs to move, or this person's, the position of this is off, and let's fix that. So that's what's happening in this part of writing the Ames page. So as you're writing it, you also need to realize you're not just a scientist. And this is hard, especially for young faculty or younger people in the field to accept. I know I had trouble with this. You are being a salesman. You're not trying to sell snake oil. You're trying to sell real science, but you are acting as a salesperson. You're trying to convince the reviewer that what you want to do is worth doing. And there's nothing wrong with that. It's your job to tell a compelling story. So you've got to be honest, but you also need to think about this from the reviewer standpoint and understand what's going to be appealing to them. Don't oversell it. You certainly can't falsify anything, but your reviewers are going to be in the field, but they're not going to be as expert in the area as you are going to be after you write this grant. So you've got to convince them about why you think this is so important and sell them. And to do that, they're scientists. They're going to want a logical, clear, well-referenced, well-cited argument. And that's what your job is to make that logical, clear, well-cited argument for your ideas. It is having read and reviewed a ton of grants, I can tell you if there are grammar or syntax or spelling errors in the specific Ames page, you immediately think this person is sloppy or inattentive or did this at the last minute, and it just hangs over your head as a reviewer. So this and the rest of the grant should have no errors at all. And if you need to, have someone pay someone to review the grant to get the formatting and the grammar right, go for it. But that is a very bad sign if there's these errors. The other thing I've seen people do is get too dependent on like bolding and underlining and all this stuff in the Ames page. Your words should be compelling. Bolding is okay in limited, or underlining is okay in a limited scope, so that you can make it easier for reviewers to see and go back and find things. But it's not, a bolded sentence has emphasis, but the way you achieve real emphasis is by telling a good story. So if you bolding every other line, it's impossible to read. Use it sparingly. Keep the grant easy to read and attractive, and only bold when it's absolutely critical to the grant. And then try to preserve some white space. Don't pack every inch of the grant of the Ames page with text. Again, the reviewers are doing this after hours. They're not getting paid to review your grant. Every time I reviewed for study section, it was at least 40 hours of work in about it was at least 80 hours of work in about a 4-week period. So it's a lot of work, and they're doing this on top of their day job. So they're often, doing this in the evening or very early in the morning. You just want to make it as easy as possible for them. They're tired, and they've got a lot of grants to review. So make it as easy as possible. That actually makes a big impact. So give them some white space. Don't make them look at the grant and start flipping through the screen, the pages, saying, "Oh my God, this is just so dense. This is not going to be fun." You want it to be visually appealing. Have some breaks, have some tables, have some figures, that sort of stuff, so that they can look forward to reading it rather than dread reading it. That's beyond the aims page, but it kind of relates to how you set up the aims. On the hypothesis standpoint, you need to include testable hypotheses if this is for a grant. Certainly for an independent, like an R01 grant, you need to have hypotheses. For nearly every other kind of grant, R03, R21, you also need to have testable hypotheses. Even for a preliminary grant, like an R34 or a pilot, like a K award, you should have some testable hypotheses. It may not be to prove that A is better than B. It may be to show that this is feasible. But you should have some hypotheses in the aims. And then it's really important to be consistent throughout the grant. So the significance needs to describe why the hypotheses are important, why proving or disproving the hypotheses are both important and will advance the field. Learning that something is not what you thought it was could be just as important as learning that your hypothesis is supported. And you've got to be able to craft your hypotheses in a way that that's true. And so you've got to learn from the failures as well as the successes. The methods then should describe how you'll get robust, unbiased data to test the hypotheses. And your analysis plan has to follow that through. What's the statistical testing that's going to happen to either support or disprove the hypotheses? And I can't tell you how many times you read a grant and what they write in the aims page and what they actually write in the methods, they're disjointed. They're not consistent. It's really important to make sure they're consistent. I know, again, that's beyond the aims page, but a perfect aims page has to be completely in line with what's said in the rest of the grant. Descriptive aims could be acceptable depending on the funding opportunity and the state of the science and the scope of the project, but all aims should not be descriptive in general. So here's some things you can do. As I alluded to in the previous slide, identify how this work is going to add to the field, even if your hypotheses prove to be incorrect or not supported by the data. It's usually not that hard. Like if these hypotheses are not supported, well, we'll still learn X, Y, and Z, or we'll get critical data on the predictors of X, Y, or Z, or the factors that influence this outcome, or on the pathophysiologic pathway of whatever disease you're studying. So you're going to learn something even in a negative study. Your job is to sell the reviewers to figure out what that is, and then sell the reviewers that that's still important to the field. You want to give an overview of the research methods in the aims page, so that the reviewer has an idea where this is going. You want the reviewer to be teed up so that when they start reading the entire grant, they know what to expect. You don't want surprises as a reviewer. You kind of want to get the outline, give them the outline so they know what to expect as they're reading. It makes it easier as a reviewer. Start and end with the aims page. What I mean by that is this cyclical process of writing it. Draft an aims page and then toss it around, get input, start working on the rest of it, and then you'll go back to the aims page to refine it. And then you'll work on the rest of it. And then you'll go back. As you may start getting deep in the weeds of the analysis plan and the sample size and realize, oh my God, I need 600 patients to prove this hypothesis. I can't do that. That's beyond scope. So that means you got to revise your aims. Maybe you got to change the outcomes. Maybe you got to revise the study design. Maybe you need to do a pre-post, something like that. So you're going to have to go back to your aims and fix that. But you wouldn't have known that up front until you got into the weeds of the power calculations and the sample size calculations. So go back in this start and end with the aims page. Whatever you do, though, make sure you read your aims page at the end after you've finished everything else, because it needs to all be consistent. And you'll have written things for the rest of the grant, and you'll be working on your wording and how you state things and the way you describe things as you write the 12 pages for the rest of the R01. And you'll realize I did that really well here. Let me go back to the Ames page and put that in because I like the way that sounds better. So it is this iterative process. Don't ignore the program announcement. Figure out what program announcement you're going to respond to early on, and then look at it. It'll give you ideas about what the NIH thinks are important areas of research and what they are looking for. And ultimately, what you are proposing is to the NIH. So there's clues in the PA about what to put in a names page. Along those lines, every program announcement at the bottom will have people you can reach out to at NIH for the project officers. And once they're not going to help you write the Ames page. You got to have an Ames page to send to them, a draft, but do that and then set up a time to talk to them and see what they think. They won't tell you, oh, this word needs to be changed. They're not going to, in my experience, they're not going to get that deep into it, but they'll give you comments about the overall scope, and they'll give you comments about how to make this fit with their priorities, especially if it's one of the limited funding opportunities. So talk to them once you have a draft of your Ames, and getting to know your project officers is always a good strategy. Know your audience. So if you know what review panel it's going to go to, and that's one of the benefits of talking to the project officer, they can give you some insight into who's going to review this, what panel is going to review it. There's different styles in different fields, like a behavioral science Ames page is different than a clinical trial Ames page, which is very different from what a laboratory-based Ames page might look like. They all have the same structure, but the spacing allocations and stuff tend to be different. So figure out which review panel your grant is going to go to, and then look at who the standing members are on there. And if it's all a bunch of PhD microbiologists, great. Write your grant with that kind of frame in mind. If it's a bunch of MDs, they're going to approach it from a different standpoint. And so you don't know who's going to review your grant, and there's no way to know which 3 reviewers you're going to get, but you want to have a general sense of what the expertise is and the background of the people who are on the panel. As a standing member for a study section for, I think it was 6 years, this was a mixed study panel of MDs and PhDs, a lot of behavioral science people, a lot of clinical people. And there was if a grant was reviewed by an MD, we had a different take on it compared to a PhD behavioral scientist or a PhD epidemiologist. So if the panel is very mixed, then you need to pay attention to writing for all those audiences. If the panel is extremely laboratory based, then you change the way you are selling the grant. And then the last thing here is, if you've not done this before, or even if you have and you want to get better at it, there are Ames pages publicly available on the NIH website, and here's a link for it. And there's nice diversity of methodologies and kinds of grants, from R03s to R01s to K. So take a look at those, and you'll get a sense for these are all publicly available examples that the investigators have agreed to post on the NIH website. So take a look at them, and you'll get a sense of what a good Ames page looks like. This is quoted directly off the NIH website. So take a step back and ask yourself, would my reviewers see my proposed project as tackling an important problem in a significant field? You need to distance yourself from your grant intellectually at some point and read it fresh and pretend you never saw it before. So what are the reviewers going to see? Are they going to see this as tackling an important problem? Are my aims capable of opening up new discoveries in the field? Would my reviewers regard the work as new and unique? And, sometimes it's hard to be innovative, but it's got to be important, and you got to have something that's new and unique. Is this going to exert a significant influence in the field? Are they written clearly? Are they easy to understand? Get outside opinions. Don't assume everyone, including your reviewers, will consider a research area to have the same priority that you do. So these are some tips from the NIH on how to evaluate your aims page as you're drafting it. Here's some things not to do. Don't use too much space trying to convince people that X is a big problem. The reviewers are going to be generally in your field. They may not be exactly, in the subfield that you're in, but if you're proposing an HIV grant, everyone in the review panel is going to have some expertise in HIV. They're all going to know HIV is a big problem. Similarly, if you're proposing a diabetes grant, everyone knows diabetes is a big problem. So don't waste your space. Space is going to be critical. Don't waste it on that point. You're not selling them on the importance of the problem. You're selling them on the importance of your proposed solution, your work. That's what you got to spend your time on. Another point to not do is to don't use a lot of jargon, especially non-standard jargon. I mean, there's jargon in every field, and some of it is acceptable, but just don't overload the reviewer who's not in your deep, sub field with a bunch of jargon, because it just makes it really hard to read. And the same with the non-standard abbreviations. Like, everyone knows HIV is human immunodeficiency virus. Fine, use HIV, but don't start making up abbreviations and then expect your reviewers to remember them. Sometimes you have to do that. Don't do it in the aims page. If you do that in the full document. But try to minimize that, because it just makes it hard on the reviewer. We already talked about not using or proposing interdependent or cascading aims. This is something I've seen people do. They are critical of other research or the existing literature. And of course you have to be in order to create this gap in the field, right? If all the existing literature was perfect, there'd be no reason for you to propose any new work, right? There's no reason to have a grant. So you got to walk a fine line, because the other work is important, and the people who did that work could be on your study section. They could be reviewing this grant. So you don't want to be hypercritical of it. You want to point out reasonable limitations and problems. There's always room for more work. Just don't be mean or nasty about it, because you're probably not being fair, and there's plenty of gaps that are out there without being a jerk. So, and then the reviewers, we all know each other at that. Once you get to the part where you're on the panel, everyone knows everyone else, and it's not like a club, but the job is not to bash what's out there. That your job is to point out the gaps in the field. And by the same token, don't ignore existing literature. Again, the people reviewing the grant, they're the people writing the literature. That's why they're on the panel. And so if you ignore them and you just say, oh, we don't know anything about this, if you ignore all the previous research, they're going to call you out on that, and appropriately so. So, you don't need a super in-depth literature review written, but you need to have done the literature review to point out the gaps. Last point, don't use AI to write. It's okay, apparently, to use AI to write better, but don't use it to generate your ideas. The NIH just released this policy on use of AI, and 2 weeks ago, 3 weeks ago. NIH will not consider applications that are either substantially developed by AI or contain sections substantially developed by AI to be original ideas of applicants. If it's identified post-award, NIH may refer matters to OR, the Office of Research Integrity. I don't know if you're familiar with the Office of Research Integrity, but if they find scientific misconduct, it's publicly posted and for all the world to see. You do not want to have a finding of research misconduct. So be careful with your use of AI, and especially in the main piece of the grant. So I have some examples we can run through. These are dense, but the only way to do this is to really look at the full aims page. So this is an example from investigator pulled from the website, the NIH website, Vernita Gordon from UT, and it's a it's a lab-based application. So looking at the structure, I have her entire specific aims page in 3 slides. Starts out with the objective right up front. This is what we want to do: determine the impact of spatial structure and mechanics of Pseudomonas aeruginosa biofilm infections in chronic wounds on virulence, antibiotic resistance, and immune. This is the goal, right? States it right up front. And now it's going to go into the first part, which is the significance, this is the big problem. It's a very simple statement of the problem. Most chronic bacterial infections are caused by biofilms, which are aggregated bacteria that are embedded in a matrix of polymer and protein. And unlike well-mixed liquid cultures, biofilm infections have well-defined spatial structure. So the big problem is chronic infections have biofilms. That's it, one sentence. And then it goes into, I'm going to identify the gap. Unlike well-mixed liquid cultures, biofilm infections have well-defined spatial structure. The spatial structure is given by the sizes of bacterial aggregates, the relative position, and they have these properties that are conferred by the matrix. Basic principles of material transport indicate that the spatial structure of biofilm infections must impact intracellular signaling, virulence, and antibiotic resistance. And here's some preliminary data coming out. However, there is little to no in-depth quantitative knowledge regarding the impact of spatial structure and mechanics on disease course. So that's their gap. They've identified the big area, they've identified, the specific area they want to work in, they've found a gap in the literature, a gap in the science, and then they say completion of the work we propose here will open new possibilities for therapeutic strategies that specifically target biofilm structures and mechanics. So that's what you can add by completing this research. And then it goes into long-term goals, central hypothesis, and a rationale for why this work is going to be important. So they state a central hypothesis, and then they go into the aims. Aim 1, determine the spatial structure and mechanics of biofilm infections in wounds. And they describe how they're going to do that with a working hypothesis. Aim 2, determine how spatial arrangements impact bacterial growth, biofilm microenvironments, antibiotic resistance, and virulence. This is not dependent on the success of Aim 1. And then Aim 3 is determine the role of spatial structure. And now they're going to add some white blood cells in. And so you'll gain more information about the leukocyte to biofilm interactions. So it's 3 aims, not interdependent, all around the same central hypothesis with individual working hypotheses for each aim. And then the expected outcome is a comprehensive understanding of what structures and mechanics develop in biofilm infections of chronic wounds, the degree to which these structures and mechanics give rise to pathogenicity, antibiotic resistance, and evasion of the immune system. And evasion of the immune system is in the 3rd aim, and the other others are in aim 1 and 2, and it's going to have a positive impact. And that's the final paragraph of their aims page. So it's a very nicely structured. You can see all the stuff I laid out in there, just different proportions. Here's a second example, and I'm kind of rushing through this so we can have some time for questions. This is a second example from an investigator at the University of Rochester. Totally different set of work. This is in people. Specific aims. Proposal addresses a key research priority in cancer and aging as recommended by a joint conference of the National Institutes of Aging and the National Cancer Institute. And they cite the the joint conference paper, and meets the criteria for the P12-136, which I presume is the funding announcement, translational research in the aging cancer interface. So they've established legitimacy of the work they're proposing, the need for the work they're proposing, by simply saying, you guys called for it. NCI and NIA said, we need work in these areas. And they said, that's what we're going to do. So that's how they said work's important. Then they moved on to the overarching goal to evaluate whether providing oncologists with geriatric assessment information and geriatric assessment-driven interventions can reduce chemotherapy toxicity in older adults. So now they're taking a step back. The proposal is important because 60% of all cancers and 70% of cancer mortality occurs in older adults. Big problem. Done. One sentence. Common assessment instruments in oncology, now they're identifying gaps, right? Common assessment instruments in oncology, such as performance tests, do not address critical domains that predict mortality and morbidity. And so then you can do this geriatric assessment in a multi-center 500 patient study. There's data here. We found that 50%, now you're into preliminary data in identifying your gap, right? Or identifying how you're going to fill the gap. 50% of older patients develop toxicity within 3 months of starting chemotherapy, and that this matters. And several studies have shown that incorporating GA and GA-driven interventions into the clinical care of older patients with cancer is feasible. And now here's the critical gap statement. What's missing? Nevertheless, the majority of oncologists have not adopted GA, which is geriatric assessment, largely because of lack of knowledge on how to utilize GA to help with decision-making for cancer treatment and deploy interventions based on the results. So that's the fundamental gap in the literature that they're going to address. And they've already set up how they're well positioned to do that. So in our University of Rochester Clinical Oncology program, we will conduct a cluster randomized study to evaluate whether this intervention improves outcomes. And then they get into a little bit of the methodology and the study design, and then they have a primary aim to determine if providing information regarding GA and GA-driven interventions reduces grade 3 to 5 chemotherapy toxicity. So this is their aim. Now, this is a little different than the aims we talked about before, because this is in a cluster randomized trial. So often you have one big aim, right? You're trying to test whether X is better than Y, and that's a whole study by itself. So the way they set this up is a primary aim and then some secondary aims. The secondary aims would be nice to know, and you'll get information about them even if the primary aim is not proven. So the primary aim is grade 3 to 5 toxicity. The secondary aim is survival. Maybe you can impact survival even if you don't impact toxicity. And then the second secondary aim is treatment decisions. And so you're getting smaller pieces of the outcome here, but that could be just as important. And then they have an exploratory aim, which is usually you use that phrase, an exploratory aim, when you don't have preliminary data, or you won't have sample size, but you want to get some information about something. With regard to expected outcomes, you want to say what you think you're going to find. The proposal will fill gaps in knowledge regarding the benefits of GA for older cancer patients. It evaluates mechanism. So this is their hedge, that even if we don't find the result we think we're going to find, that this intervention makes a difference, it's going to evaluate the mechanisms by which the outcomes occur. And that's a critical finding for the field, even if this intervention doesn't work. And it'll have a positive impact. So that's the second example. And then the third example is an Ames page that I was funded with. So we got together a team to do this proposal. This is an R01 that we're in year 3 now. So this is a structure that is more along the lines of what I outlined. And in my experience on clinical not clinical trials, but clinical research, this structure is commonly used. So the first paragraph sets up the problem, the big problem. Ending the HIV epidemic in the US is going to require new approaches to identify people with unsuppressed HIV. And I go through different ways to do that in the rest of this paragraph and what's wrong with those approaches, like data to care and using public health systems. So that the problem is we don't know how to find people with HIV who aren't in care. Kind of obvious. The second paragraph sets up what our idea is. So during SARS-CoV-2 pandemic, wastewater epidemiology was used to identify areas that were about to have a increase in COVID-19 cases because you can detect it in the wastewater. And so just a brief bit about that and why Houston is a cool place to do that in, because we have 39 different wastewater treatment plants. And so wastewater epidemiology was used in SARS-CoV-2. That's the point of the second one, and it sets up preliminary data. Wastewater epidemiology is unbiased, comprehensive, real-time, quantitative, and not influenced by access to healthcare. And so now I'm setting up the gap that this can fill. HIV is shed in the human stool and urine, and our preliminary data show that we can detect it in wastewater. And so we hypothesize that our pioneering wastewater sampling program can be applied as a powerful new tool. So I said, this is the big problem. Here's the gap in the literature. Here's our preliminary data that we have to fill that gap. And this is our hypothesis that we're going to be able to do this. We actually have 4 aims in this project, which is unusual, but each aim is not dependent on the prior ones. And we included one that's public facing ethics and stuff. So that's that example. And then I summarize it, how we're going to do this and what the impact's going to be. So putting it all together, the specific aims page is just a critical page. It conveys all the key points about the application. It's got to be compelling. It's got to be logical. It's got to be readable, because the reviewers might go back to it. You can't overpromise, but it's got to be substantive enough to meet the goals of the opportunity. It's both a summary and a guide. So it summarizes what you're going to do, but it also sets the stage for the reviewer to know what's coming. And so it needs to function as both a summary and a guide. And my advice is to write it and then do some other stuff on the grant and elsewhere, rewrite it again, and just keep going back to it to make it as perfect as possible and reflect what you want to do as accurately as possible. Want to acknowledge the funding I've had over the decades of my work and a bunch of collaborators and institutions I've worked with. So I'll stop there and happy to take any questions.
Thank you so much, Dr. Giordano. I learned a lot, and I cannot wait to apply for my next grant writing. We have a few questions in the chat. I will start from the first one. And also, welcome to this webinar. If you have any questions, please feel free to raise your hand or put in the chat Q&A. If you raise your hand, I can unmute you. You can ask the question directly. We also have our VP here. She said, thank you, Dr. Giordano, for sharing your expertise. Our first question in the chat is, if it's a 1 or 2 year grant, do we still need 3 aims?
No. It's got to be within scope of the opportunity. There's 3 is a common number for a 5-year grant, but it's not necessary. You should propose aims that you can do in the time allotted, and if that means 2 aims, that's fine. In R34 that we recently completed, we had 2 aims because it was a 3-year project, and that's all that we needed to do. So.
Thank you. Next question is, do you suggest putting figures on the specific aim page?
It depends on what you're doing and what you're proposing. You don't want the reviewers to get bogged down in the details in the aims page. So if the figure can concisely convey a lot of information without overwhelming the reviewer, it's okay. But the aims page is usually more about words than about figures.
Okay. Our next questions, how do you persuade reviewers of different disciplines about the importance of our disciplines, for example, pharmacy?
Yeah, that's a tough one. I mean, you need to have a multidisciplinary approach often. And the pharmacy approach is highly, it's very necessary. Depending on what you're proposing, it could be very clinically relevant, pharmacokinetic and pharmacodynamic work. There's all kinds of drug-drug interactions. I'm not sure, there's a lot of different things that could be included in a grant written by a pharmacy with a pharmacy angle. It's the same problem that everyone else faces. A lab-based researcher might have a clinician reviewing, and a clinician might have a statistician reviewing. And so everything is multidisciplinary these days, and your reviewers are going to be multidisciplinary. It's all about crafting the story, and knowing that there's some relevance to the work that is that you can describe. It's hard to say more than that. But a good strategy is to write it and then have a non-pharmacist review it and see what they think of your aims and give you some feedback. I'm sure you guys all have clinical colleagues who you could ask to do that. Depending on the aims, find people to review your aims.
Thank you.
Good afternoon, Dr. Wang. I'm sorry. This is Michelle. Please forgive me. I have been listening to this even from my seat in the eye doctor. This has been phenomenal. I've also been a reviewer for a study section for NIH. Everything you shared was spot on, extremely helpful. Those specific aims are so hard to write. And I love the insight that you shared. And we would love to have you come back when all of our faculty are here, because the nuggets you provided will help us win proposals, will help with the funding. And the mentoring that you have provided to Dr. Wang and possibly even Dr. Poon. I know there's another person that you've mentored, to be able to give back. If there's anything you can help us teach, because some people have the talent, but they can be very self-serving. And I can tell by your CV, I can tell by the people you have helped that that's not who you are. So we honor you today, and we really do appreciate what you've shared. And the 80 hours on those proposals is a real thing. So, and even then, because you keep going back, hoping there's something, people have worked so hard, and you hope there's something in there that you can give a point or two, or at least some advice
Right.
for a resubmission. So.
Yeah.
So
Thanks,
what-
Dr. Penn Marshall.
No, just please call me Michelle. It's my pleasure. It's my pleasure. And
Thank you.
anything that we can do to support your work or that of your partners, because there's so much talent at TSU, please let me know.
Will do. Appreciate it. It's nice to have the validation of someone who's got the experience.
Oh my gosh. Thinking maybe I'm not reading, maybe I don't understand. And I love what you put up for AI, and how NIH, because sometimes we're thinking, okay, I just need a little bit of assistance, but you don't want your reputation or your institution's reputation to be marred in that way, because as large as these institutes are, even with the changes that have taken place, it's still a very small scientific world.
It is.
Okay, I'm going to be quiet now.
Thank you so much.
No, thank you.
Thank you, VP Penn Marshall. So I have one question. My question is, because of those aims, so how much we should include for the research expertise, your team's expertise, also the preliminary data in the specific aims page?
It depends on the grant you're writing. If you're writing a K application, a K08, K23, K99, you need to talk about you a little bit as the PI, the person, because the K grant is about you. It's not about the research. It's about developing you. And by the same lines, you need to talk a little bit about the mentoring team. Don't go into great detail, but just reassure the reviewers that you've got the bases covered when it comes to the expertise that you need on the mentoring team. On the other hand, for an R01, honestly, if you're proposing an R01, you need to talk about preliminary data in the Ames page, not so much about how great you are, because you're applying, unless it's your very first R01, you might mention that you're an early stage investigator applying for an R01. But otherwise, the expectation is you know how to do this, and save that space, use it in the specific Ames page, use it to describe the importance of the work and the preliminary data you have to sell the concept.
I have one more question is about the study section. Kind of know everyone's background. They're from clinical or basic science. Do you suggest us to go actually research pretty much everyone's research background?
No, that'd be a waste of time, honestly. I would not do that. What I would do is just get a sense of the institutions they're at, their degrees, like what fields they're in. But just to know sort of the rough composition of the study section. Don't spend a lot of time digging deep in. That would not be efficient.
Thank you so much, Dr. Giordano. I didn't see any questions. Really appreciate you come here and share your expertise, and I believe it help our TSU research community. Really appreciate it. Hope you have a great day, everyone. Have a great day. Thank you.
Thank you. It was a pleasure talking to you guys. Take care.
Here.